So welcome back for another part. Welcome back for another part. And here we will resume working on what we started right now. We'll resume working on it. So one of the main important points we want to talk about just now, one of the main important points is let's go to it, types of work in home care. So home care, like we said, home care, there are type of works. There are two types of works actually in home care. We have non-medical care and we have medical care. In the non-medical care, like check-in visits, companionship, exercises to be done to the patient, light housekeeping, cleaning or whatever, meal preparation to prepare the meals for them, medical escort, medicine reminder, just to remind them of the medicine, but the medicine is still the responsibility of the nurse, night caregiving also, and showering and dressing and shaving, even shaving their beard and so on. Also, this is the non-medical care, but the parts of the medical care, like as example, home nursing, catheter, tubes care, catheter tube, the IV drip, the medication administration, the PEG feeding, the respiratory care, stoma care, vital signs monitoring, vital signs like as example, like the blood pressure, the temperature, and the heartbeats, just to be watching it, and wound care as well. Home medical like doctor consultation, basic health screening, simple surgeries, and ambulance transportation. Home therapy like physiotherapy, speech therapy, occupational therapy. So those are the part of the medical care. Those are the part of the medical care. Like we said here before, providing a client safety, client's home may present many safety hazards, like as example, frayed electric cords and unsafe smoking practices. Discuss any safety concerns you have with your client or your supervisor and your supervisor. So here, benefits of home, healthcare, personalized care, comfort, peace of mind, dignity, family support, because the people there will be helping you. The beloved one of your patient will be helping you to do your mission. They will not only be watching you. Security, and there's money also, bonus money, independence, and the safety and the freedom as well. Yes. So, like we see here, it's full of advantages. It's full of advantages. One of these advantages also that you take the directions from different healthcare providers, like as example, the nurses, the physiotherapists, they will tell you what to do and what not to do, and so on. Here is repeating it back. Then we'll go to the next as example, dealing with people in distress. Yes, those people who are patients and you as a personal support worker, as a home care, these people usually in distress because of the pain and because of the suffering. So you will be like for them something to hesitate their paining and try to make them comfortable as much as you can. The PSW work when you go home care, you decide your own schedule, you decide your own work, you decide on when you want to work and when you don't want to work. So these activities, you can do it based on what you wish and when you wish. Uh, so this is working on your own. Flexible work assignments, of course, since it is based on your choice, then it's flexible. So, most of the employers expect support workers to arrange their work schedules around the client's care needs. Some employers will also permit the support worker to schedule their assigned shifts around personal time commitments. This allows for a greater job flexibility and satisfaction. So working from home would make it very flexible for you as a personal support worker as well. Here are the advantages again of working from home, visiting the clients or the patients at home. So it's easier daily life for the patient, freedom, because you are not tied up in a hospital, whatever. It's peace, you peace your mind. It's personal attention because you and the patient, you as a personal support worker and the patient. Of course, there will be kind of emotional attachment. There will be a kind of emotional tract and so on. Mental health, longevity as well, and cost cutting because if they are treated in hospitals, they would be costing the government more. For that reason, it's cheaper to do the services at homes, at the client home. Quality of life, like we said before, and we discussed the quality of life in the previous lecture. Comfort, yes, I am here at home and the PSW is coming to me. That makes me feel comfortable, and flexibility because it's based on the willing of the personal support worker when he would like to go to do the service, to provide the health care, when and where. So this is flexibility for the personal support worker as well. Yes. Now, since the home care is increasing, the personal support workers also, there is became highly demanded now since this industry is booming as well. So the current trend with the Canadian healthcare system is to decrease hospitals costs and to increase into community-based services like less hospitals and more home care. Less hospitals and more home care. Just stop right here now and get back to you again. Thanks.